Now, every child has a right to healthcare, education and safety. Well, that's the ideal, but it's far from reality. In 2019, over 58 million children worldwide did not go to school. That number grew to over 200 million by 2021. 19% of them are from Sub-Saharan Africa. Well, let's delve into this and other matters as we mark International Children's Day, June the 1st. I'm joined by Mandy Pearson from the Bhambayi project and Momeena and Makiba Yamano from Unicef. And Momeena Omarjee from SANOFI, a private company, who's joining us on the line. Good afternoon, ladies. Welcome to today, and thank you very much for your time. The theme for this year's International Children's Day is about eliminating harmful practices, that affect our children. Can I start with you, Makiba, from a UNICEF perspective? Are we making any progress at all in protecting our children from harmful practices?
Thank you so much. Can you hear me?
Yes.
Wonderful. I think we have been working together with governmental partners, especially for development of social, Department of Social Development, in tackling also making social behavior change program. Now, for us to address harmful cultural practices or eliminating harmful practices, we would need to address the underlying causes, which sometimes comes from masculinity among the different genders, or the parenting models that parents need to be a role model to the children to show what would be the desirable behaviors, or peer-to-peer education. So from that perspective, we would like to emphasize on the social behavior change program that is tackling these kind of underlying social norms and then the gender norms. Are we making progress? I think it is a quite difficult question. So far, we haven't seen the statistics going much improved in South Africa. Having said that, I think we also need to scale up some of these preventative and social norm change programs that are at scale. And for that, I think media house such as television or social media would be playing an important role in addition to the government and international agencies' effort.
Now, what I hear, Makiba, you say that we all have a role to play. Let me bring you in, Mandy, from the Bhambayi project. You focus on orphans. I think on your website, you tell us we have some 3 million orphans in our country today. And of course, we know times are very difficult. Are you winning in protecting our children from harmful practices?
It's incredibly challenging. Good evening, Dan. Sorry, good evening, listeners. What we are finding, I totally agree with what Makiba was saying about those needs. What we have found also is a really critical issue is the systems and processes that are meant to be there to protect our children are not often protecting them. We've had issues, whether it be justice, police, child welfare. There's some amazing people within those systems, but often we have found where they are just not there, seemingly protecting the children like they should be.
Yeah, and we need to protect our children in different ways from different situations. Let me bring Momeena Omarjee from SANOFI, which is a private company. Momeena, good afternoon. Welcome. I understand you're joining us on the line. The private sector, I mean, do you think we're playing an important role for our children's safety? Okay, we seem to have lost that connection with Momeena. We'll continue with Makiba Yamano from UNICEF and Mandy Pearson Bhambayi project. Now, Makiba, you said we all have a role to play, different stakeholders, but most of us will tend to look to government and in terms of social development, but government also has to support NGOs like the Bhambayi project of Mandy Pearson. Where are the gaps currently? What are you seeing as UNICEF South Africa?
I think I would like to also go back to the Bhambayi project CEO has mentioned in terms of how we can make sure that systems are strengthened. And in that sense, I think we all need to join our hands together. So the government, of course, plays a vital role in setting the policies and guidelines together. And then us also international agencies supporting technically in that effort as well. But we also need CSOs who are working on the ground, closer to the communities, especially with the families and children themselves, and then the community. Now we need that significant coverage on the ground. I think we would also need to consider how we can scale up systematically across the hotspots in order to address some of these issues. I think what we are seeing now, especially on the recent crime statistics by the SAPS, we are already seeing quite significant increase in the attempted murder of the children. And then also that the number of the children who have unfortunately killed is not going significantly down. And then for these kind of statistics, it is quite horrific that it is quite remarkable that it makes us all sober. We need to join our hands together, and then this is something of crisis. We are also marking this week Child Protection Week in South Africa, and then I just would like to call everyone's hands to be united to keep safety and protection of the child as a key issue to be remain on the table.
Yeah, child protection is very important. I'm told we've got Momeena Omarjee on the line with us from SANOFI, which is a private company. Momeena, good afternoon. Can you hear me?
I can hear you. Good afternoon, Broden.
Okay, welcome. I was just asking from a private sector. I mean, I've got Makiba Yamano from Unicef and Mandy Pearson from NGO Bhambayi project. They work mostly with orphans, empowering orphans. But from a private sector, I mean, Makiba was saying all of us, including us in the media, we all have to work together as South Africans because there's a big crisis. I mean, we are killing our children. You've seen the latest stats, for example, and protecting them is very important. It is Child Protection Week currently in South Africa. But what role do you think the private sector can play for our children's safety?
I 100% agree with you and the colleagues as well. It's when disaster strikes and when a crisis strikes, it's crucial that we all work together to do whatever is required to protect the country's most vulnerable, who are our children. And on International Children's Day, as much as it is about highlighting the plight and the struggles of children, it's also for us to reaffirm our commitment on this collective role we have as parents, as caregivers, as civil society, as government, as private business, to ensure that we're protecting our children, protecting them from child abuse, the deprivation of their right to have access to basic needs, one of which is water, but also to ensure that every effort is made to improve their lives. We know that there's many underserved communities right now, Bradan, that do not have access or adequate access to clean, drinkable, potable water. And as a consequence of this, there's a higher incidence of diarrhea and diarrhea-related diseases. And what this does is the children living in these underserved communities are 10 times more likely to contract and even die from diarrhea and from drinking this contaminated water. As private society, as private business, we can have partnerships. And what we at SANOFI at the moment are doing is through a leading partnership with Save the Children South Africa, who's a global NGO with a local footprint, we want to reduce this incidence of diarrhea and diarrhea-related deaths in children under the age of 5.
I guess access to healthcare is an important part for children. I mean, we all know about the current cholera outbreak in our country. I think the death toll this afternoon stands at 25 people. The latest to have succumbed to cholera is a 73-year-old woman in Mpumalanga. But children have also died there. Mandy, the efforts that you are seeing as you work on the communities to make sure that our children have access to healthcare and education. I mean, in my introduction to our discussion, I mentioned the staggering numbers or global numbers about how many children didn't go to school in the past couple of years.
Yes, we've come across an alarming number, never been in school. This year we've had an influx, and so the oldest 11 years old so far, never been in school. And this is in an urban township. So it's quite remarkable that, there's still many children out there not in school. Often it's the case of substance abuse, neglect. Sometimes it's just a case of birth certificates, and the caregivers having had huge issues with trying to get birth certificates. So we really work on a lot of those processes with the families, getting them into school.
Yeah, I don't want to be known as a bearer of bad news only. I mean, about our children. It is International Children's Day, the 1st of June. Is there any silver lining that you're seeing, Makiba, that from Unicef South Africa's perspective, the things that perhaps we're doing right, we could improve on as a society in terms of the rights of our children to access all these basic needs and also protect them?
Thank you, Dan. I think we are seeing a quite significant momentum in terms of joining hands together. And we have been also joining some of the events related to Child Protection Week in this week in South Africa. But we can see interdepartmental collaboration happening between the Department of Social Development, say, for example, with DBE, or even Film and Publication Board, or Department of Health, SAPS. So I think there is a willingness. I think we just need to also make sure that this partnership yield the results with the scalable flagship program. I know the department also supported by UNICEF, and then also a partner like USAID have a social behavior change program, as well as the prevention program that is called RISIHA, which is trying to bring children from vulnerability to resilience. So this type of program is good and it is evidence-based, but I think we need also more resources to make sure that it is scaled up. Secondly, I think we also need to create more platform and spaces where we can have young people, children themselves, youth themselves, are able to voice what they want, what they need, and then how they can contribute to our country, because they are the future, and then they have their say. And then I think within our work stream, having children's voices and participation in center and front, that should be also the vehicle for us to moving ahead together. And that would be our silver lining for us to move beyond what we are seeing today.
Yeah, more cooperation, more collaboration, partnerships. Momeena, how is your partnership with, is it the Save the Children Fund and SANOFI going?
So our ambitious campaign with them was to impact over 2 million lives by 2025. And the way we want to do that is, as we said, through improved access to clean potable water, by putting in water tanks with filters, hand washing stations at early childhood development centers. We started off in Inanda in October 2022, and it's going amazingly well. We've already implemented and put in 15 water tanks and 14 hand washing stations in Inanda, and we want to expand that across the country nationally, because we realize this is it's not a local problem, it's not a provincial problem, it's not even just a national problem, it actually is a global problem, and we need these partnerships to step in and support the communities that we've identified that have this lack of resources and access to potable water.
Yeah, so you are focusing on access to potable water in terms of sanitation and hygiene. I mean, and then, I mean, in the context of what's happening in the country currently with the cholera outbreak in Hammanskraal, I'm sure the people, the children of Inanda are really appreciative of that effort.
100%, but I think everybody is really appreciative of any intervention that they can get at this moment in time, especially in terms of water and access to water.
Yeah, now you had Makiba there from UNICEF talking about the need to work together more for more cooperation, and it's happening. There's been an improvement. But as a private sector player, we always hear about the need for public-private partnerships in South Africa. What would you want to see being done differently as SANOFI?
Through the public-private partnerships, you can gain access and you can expand the programs that have already started. So instead of starting programs from scratch in specific areas, the public-private partnership would come in and ensure expansion, quicker expansion, faster expansion, and more efficient expansion and access to water.
Are you going to do more of partnerships?
Definitely.
Yeah.
We are there for more public-private partnerships and private partnerships as well. Collaboration is the key, and it's the crucial key to ensuring equitable access.
Yeah, an NGO like Bhambayi, Mandy, would it benefit more from the increased partnership and collaboration and cooperation that both Makiba and Momeena are talking about?
For sure, definitely. Those partnerships are critical. And just coming back to what Makiba said, I love the way she talked about the top-down approach and dealing with all the systems, but also the bottom-up approach. And we found that critical. So it's not just dealing with the bigger players, it's in the community themselves. We've actually got a march that we're doing tomorrow, and it's the community themselves led by the children, and we're going to march from Bhambayi to the courts and hand over a petition. But it's that positive power that the community, especially the children, having their voice and being able to be agents of change, because that's really a key goal for us, is for them to be courageous agents of change. And so I think it's all players. It's the top, the big NPOs working together, as well as with the communities and really empowering them to bring that change, I think is critical in the process.
Tell us a little bit more about the march that you're planning for tomorrow. Give us a bit more details.
So it's driven, there's an actual video that supports it, and we've got a petition that's on the change.org website, change.org/fight child rape. And that's our petition. And we will be marching. The community for the first time has come together. It's really exciting because Bhambayi sadly is the smaller part of 3 different wards. So there's no combined community leadership. And so for the first time, we're seeing the community coming together over this. They're starting to talk about other issues of safety in the community through these discussions. And we will be leaving at 1 o'clock from Bhambayi, from the Mahatma Gandhi, outside the Mahatma Gandhi house. And we will be walking for the 3 kilometers to the Intezuma courts and handing over our petition to there. Our children will be handing it over at 2:30, and they've got a few poems they've prepared, and to senior people on the justice, on the NPA side, and on the police. Yeah,
I know you don't do feeding scheme, but you're dealing with orphans, and just last week Sunday on ENC we're talking about food security and how children are affected the most in terms of their nutrition. And when they're not being well nourished, they get stunted, and stunted growth leads to all sorts of complications as they get older. Do you find that is a big challenge in the kind of community where Bhambayi is currently operating, Mandy?
Yes, it's an extremely difficult issue, but it goes hand in hand with the issue of dependence and lack of dignity. So if one's giving handouts of food, how does one ensure there is dignity and you're not creating dependence? So for us, a real focus is how do we enable the caregivers in terms of employment programs? How do we create positive ways? And obviously where there are critical issues, we step in with the nutrition, but we look first and say, what are ways that are more long-term solutions that enable dignity and being able to look after themselves as opposed to being dependent.
Yeah, and from UNICEF's perspective, I mean, is it kind of a program that you would support, Makiba, where you're looking at that holistic approach to children, not just one aspect?
Fully, definitely. Because as Mandy was earlier saying, it would be very difficult if we are making children, families, and community dependent. So we would definitely looking into sustainability, but at the same time also holistically. And when we talk about children's rights, we are seeing different needs and then the rights of the children, such as survival, and then such as development, such as protection, and participation. The nutrition or malnutrition you have talked about is definitely part of the survival needs. And when we are talking about children's program, we would like to cover different area of rights and then the needs of the children as UNICEF. I come from child protection background, but we also have education team, health team who covers HIV and nutrition, which is a prominent prevalence, unfortunately, in South Africa. So when we are programming together, such holistic program would be more, we are seeing more impact on the ground, especially at the community and family level, and then more sustainability would be important for us to see the lasting long impact.
Okay, as we conclude very briefly, let me just go around quickly and just get any parting thoughts if there's something else I might have missed in our very important discussion. Momeena, let me start with you on the line there from SANOFI. From a private sector perspective, what other element, just one that comes top of mind for you that we need to pay attention to protect our children and give them a safer and more prosperous and on a sustainable basis, more prosperous future?
I'm going to go back to the public-private partnerships, the partnerships as well, even at the community level that Mandy and Makiba have mentioned. Is we know that everybody's working tirelessly to improve access to water in these, in the affected areas, and also just that children's rights. Greater intervention is needed, and we need to strive to ensure that no child dies from a preventable cause, especially when there are interventions and treatments available, and it needs to be this sustainable intervention as well.
Yeah, I think one of the things as you were talking there, I was thinking immunizations. I mean, we saw measles outbreak in our country earlier this year because many children have not been immunized, but we need to be helping there as well. Mandy, your parting thoughts?
Yeah, I come back to the point I made at the beginning about systems really being held accountable. And I didn't actually mention in terms of the march where, an example, we've got 7 demands, but one of them is really around bail for rapists. And it's a Schedule 6 offense, so rapists it should be virtually impossible for them to get bail. And we're finding it's happening all the time with 3-year-olds, 5-year-olds, raped 7-year-olds, and they get bail. It's things like that. How do we hold the system to account for what the promises are? There are a lot of wonderful things in our systems. How do we ensure that they're actually happening in reality? And for me, that's what I'd really love to see, and us all work together, communities, NPOs, all the various sectors holding hands, working together to ensure that happens. And to say a thank you for those who are doing all they can to protect the children. We really appreciate that.
Thank you very much, Mandy Pearson from Bhambayi Project, Makiba Yamano from Unicef South Africa, and Momeena Omarjee from SANOFI. On this International Children's Day, June the 1st, we were just talking about a number of issues that are facing our children and how we can ensure that children's rights to healthcare, education, safety, clean water, and so on are really provided in this time. Lots of gaps, challenges, but working together, that's what Makiba from UNICEF was saying, collaborating together in public and private partnerships is the way forward to make sure we really do what we should be doing in terms of our children.